We're connecting with more healthcare professionals than ever before and are seeing new horizons of chiropractic care before us.
Well, I see the profession going in a very good and exciting direction. And I think newer technologies are leading us there. I think a lot of patients are really appreciative of the fact that what they believed an adjustment is actually very attainable for them now with the various different techniques that we have, building on the wonderful traditional adjustment that we've always delivered. And we have something for everybody. Technology is going to be really the keystone for chiropractic. It's going to finally allow us to show and demonstrate what we've always been seeing clinically, but have never been able to measure. Recently, we have found that tools from distant fields such as cardiology have been actually very useful in the chiropractor's hands. One of these tools is heart rate variability. And what we're gathering is a very large database. Perhaps it is going to be the largest database of heart rate variability measurements in the average population. These tools are helping us to actually attain information about the way that individual's nervous system is working. And because the chiropractor is interested in the nervous system function, regardless of the symptom that it may be causing, such as back pain, headaches, neck pain, and things like that, the chiropractor today, I believe, and in the future, will focus on solely what is the ramification in the nervous system which is causing the symptom. Certainly, if we look at medicine, we can see that they will ask a patient about their symptoms and treat the cause, or attempt to with a drug or a surgery or an intervention. Chiropractors similarly, as I can see from this point forward, are moving dramatically more towards finding the cause and correcting it. And it's usually an area that isn't painful, so that the symptoms that the patient came in with have an opportunity to truly heal themselves. So the one thing we can count on is this: the body is self-regulating, self-directing, and self-healing. And chiropractors appreciate, for over 100 years, have appreciated that healing potential in the body.
Okay, you ready, Taylor?
Yep.
The things that I'm working on right now are trying to understand not just what impacts a patient, but also how the clinician is able to deliver the type of care that they do. And so if you think about it, when a patient is referred to a physician and that physician makes a prescription, they can prescribe a very specific dosage. A really tough question for any profession that involves manual therapies, specifically chiropractic or massage therapy, is what is a dose of care? How do you define a dose of care for a manual therapy? So in my laboratory, we're working on trying to discover what is a dose of chiropractic intervention, and how do you measure that, and how do you describe it, and how does a clinician make the decision on what dose to administer?
Members from the MCA have been asked to come in to participate in numerous research studies that we've done here. So with our dosage studies, they're able to come in and contribute in a meaningful way by being research participants, so that we can study what is a dose of chiropractic care.
I am a part of a collective of researchers who have been advancing the profession together. So my individual contributions, I like to think of them as little bricks. And every study that I do is a brick that I've made from my lab with my lab group, and each year and each study that gets published is another brick that gets made. And all the other chiropractic researchers across the country, they're working in their labs and they're making different bricks as well. And so all of these little bricks of knowledge then become pooled together, and collectively we can build a strong foundation upon which the chiropractic profession can sit comfortably for the future.
We're steadily moving forward on initiatives that will benefit every member.
The RHPA is a newly proclaimed piece of legislation that the Manitoba government has brought in. It's referred to as umbrella legislation. So basically what that means is it's legislation that encapsulates all of the regulated health profession under one umbrella, under one act, and then each profession will have specific regulations that are specific to them, defining the things that they can do and how they must do those particular things. And so it's a model of legislation that has been rolled out in many other provinces, and Manitoba is basically coming on board with that type of legislation.
We've been seen to be leaders within our group
and the initiatives that we've taken both on the regulatory side and with on the association as well. But we've negotiated good contracts with our stakeholders that we're very proud of, some of the best when we look across the country compared to other provinces, and as far as the coverage for Manitobans. That's something we hope to carry on and just build on.